Hello and welcome back to our Webinar Wednesday series. We're excited to be back with you today. We have a couple of special guests with our Student Health Center and Pharmacy as well as our DCH Regional Medical Center. Again, I am Allison Beasley and I'm your coordinator of parent and family programs here at the university. And we just wanted to bring you a what happens when my student is sick and they need to go to the Student Health Center or to DCH Regional Medical Center, and we want to give you direct resources from these facilities. So without further ado, I'm going to pass it right on over to our Student Health Center and Pharmacy.
Well, welcome from the Student Health Center and Pharmacy at the University of Alabama. I'm Margaret Garner, the Executive Director, and what I want you to know is that we are exclusively serving enrolled students at the University of Alabama, and we are eager for you to learn more about us if this is your first time to hear about us. Our mission is to deliver not only outstanding health care, but also to intentionally educate UA students for healthier living. And we are committed to excellence. That is your assurance of quality medical care. The Student Health Center is accredited by the Association for the Accreditation of Ambulatory Healthcare Facilities. That's a mouthful. And we have been accredited by them since 1995. What you need to know is that AAAHC represents the most rigorous standards for ambulatory care in the U.S. In fact, they are the accrediting body that accredits outpatient surgical centers in the United States. And I have an update for you. About 400 student health centers across the country meet this high-level standard. For many, many years, until about 5 years ago, we were the only student health center in the state of Alabama that were accredited by AAAHC. Also of importance is nationwide, only about 20% of student health centers are accredited by anyone. So what this does for you is it provides evidence of quality, and we are re-accredited every 3 years. A lot of the academic programs are re-accredited every 8 to 10 years. But because of the importance of assuring quality and safety for patients, AAAHC requires re-accreditation every 3 years. For this, I can assure you that the Student Health Center provides responsible and evidence-based practice. What I mean by responsible is we wouldn't have the antibiotic-resistant strains in this country if antibiotics were not overused. So we see part of this responsible care to educate our students for what to expect from medical care. So we spend a little extra time with our students for that. We've been proudly serving UA students since at least 1887. For those of you that got your degree from Alabama, you're very familiar with the historic Gorgas House. And in 1887, that was the site of the Student Health Center. Since we were formed in 1831, I'm quite sure we had health care before that. I'm still looking for evidence of what and where. But no surprise to you, these are the services that your Student Health Center provides for your students. One of the things that I'd like to provide some additional information beyond this need is when we cannot provide the service that our students need, we have 2 referral nurses who work diligently to make those referrals in the community, make the appointments, and provide 360-degree communication to those specialists and back to our providers so that the kind of continuity of care is assured, and that is very reassuring for you. In addition, the health promotion and wellness education is a major pride within the Student Health Center. We have 4 award-winning peer education programs that provide over 55 hours weekly of peer education on a health topic that changes every week. This is led by master's and PhD level health education specialists. Very, very proud of that. In addition, we are flexible and accessible. During the academic year, when all 38,000, almost 39,000 now students are here, we are open 62 hours a week, the most generous level of accessibility in the Southeastern Conference. So you see in the academic year, we're open 12 hours Monday through Thursday, and on Fridays we end at 5, and we have weekend clinics on Saturdays and Sundays, except for those amazing home games when we have over 100,000 guests to the community. But these are, again, the most generous hours. And we are located conveniently on bus routes. So you see that there in case your student is saying, I don't know how to get there. There are 3 bus routes that stop right outside the Student Health Center. I'm not going to go over all these numbers, but I wanted you to have them for today as well as in the archive of these webinars. I want to make 2 points. The billing insurance number is for billing health insurance questions for your specific plan. We have an extremely competent billing department who works with over 400 health insurance plans across the nation and 70 countries in the world for students that come here. So they can help with any of those kinds of questions about what they cover and what and why, and help resolve any issues with that level of coverage. So just to explain, that's what that is. Because the next one, student insurance, the university has a sponsored student health insurance plan in conjunction with United Health. It is excellent, and what it covers for the cost is outstanding. We have had some parents at parent orientation that have looked into their plan and the cost for having their children on it, who have actually moved to the university-sponsored health insurance plan. So that's what that is, and if you have questions about that or want to compare, that's the number to call. What to do when my student is sick. And one of the things I'd like to say is, parents, help us and help your students think through this realistically. Most of your family practice offices at home are not open until 8 o'clock at night as ours are. And if your son or daughter was sick, but you could tell it was not of an emergency level, you wouldn't run to the emergency department. You'd wait till the next day. So if your student calls and they're sick after we are closed at night, encourage them to come in the next day early as possible. We have fewer students that decide to come at 8 o'clock in the morning than 11 o'clock, and I know you as parents understand that. But most things can wait until the next day. But that said, just as when you're home is when you know, or your gut knows, that this is a true emergency. Don't waste time. Don't go anywhere else at 10 o'clock at night. Go straight to the emergency department, because that just delays care when there is a true emergency. And this is a way you can keep up with us by visiting our website. In addition, if you have questions that we don't address today, there's a long list of frequently asked questions that you can find on that website. And you can follow us on social media. So now it is my great pleasure to, oh, sorry, I forgot I had one more slide. This is so important. The Office of Student Care and Wellbeing is a truly wonderful office at the university that, again, shows how much we reach out to show care and concern for students. The on-call deans is what they're called, and they are available 24/7 when a student is hospitalized. So with the student's permission, they will provide notification to their faculty of their course schedule that for medical reasons they cannot come to class. We've had some that need to be out for 3, 4, or 5 days. They can do that, and faculty are confident that there is a true medical reason for that absence, and they can take that into consideration. In addition, they are willing to reach out to you if the student gives permission. And so here I'm reminding you that we, as well as the hospital, are under federal law about what we can disclose or not without the student's permission. But that is a wonderful resource for those students when hospitalized or being seen in the emergency department. And they also can share right on the spot helpful resources on campus for follow-up services. And your student health center is obviously here for follow-up care from any emergency room or hospital stay. And now, it is my pleasure.
And a shameless plug for next week's webinar, we will also be talking to Student Care and Wellbeing to give you a little bit more information about what on-call deans are able to do in their role and how they can help you, especially when your student is hospitalized and when they need that extra level of care when you're not there to help them out.
Thank you, Allison, for that plug. And now introducing Dr. Blake Lovey, an emergency room physician from our community hospital, Druid City Regional Medical Center. I don't know why I stumbled on that, Blake.
Well, that's good. Yeah, I'm Dr. Lovey. It's nice to meet you guys. I will say the on-call deans are amazing. I see them regularly in the emergency department, particularly any game day or weekends. I'd say they pretty much live in-house with us, and they're there constantly with the kids. And the students at University of Alabama are overall very responsible, and I rarely see a student by themselves. They're there with their friends, and the dean's there, and they have a ton of support from the university. And I'm really proud to partner with the Student Health Center here. The Student Health Center does an amazing job with the patients they do see here. They provide excellent care, and they appropriately refer patients to the emergency room when they need to come. And we'll see them sent over occasionally if they are a little sick or need to be in the hospital. And also, whenever we're done in the emergency room and it's time for them to go home or back to their dorm, I know they have a safe place to be seen the next day that'll follow them up appropriately and very efficiently. They do a good job of plugging in roundabout. So what I'd like to do next is just tell you a little bit about our hospital. So DCH is the name of the hospital here in Tuscaloosa, Alabama. You go to the next slide. We actually are comprised of 3 hospitals. There are 2 large hospitals here in Tuscaloosa. DCH Regional Medical Center is very big. It's the tertiary referral center for this area. What that means is that they transfer in patients that need specialty procedures from all the smaller hospitals in the surrounding community. So we're one of the biggest hospitals in the state. Northport is an excellent medical center. It's the north part of Tuscaloosa, and it's very nearby. So some of the students will come to the emergency department there at Northport as well. And then Fayette's a smaller hospital that's located probably about an hour away, and it's not a place that you guys will interact with much at all. I'd say I see the majority of the students at DCH Regional. It's the largest, and we have the most resources. As far as what we have and things that students face, occasionally you do have students involved in some type of trauma. They fall or are in a car wreck and that kind of thing. We're a level 2 trauma center. We have dedicated trauma services 24 hours a day. If for some reason your child was in a trauma, they would have a trauma surgeon at their bedside when they came in. We have access to any specialty you would need: neurosurgery, heart surgery. They're all here in-house. Anesthesia and OBGYNs live at the hospital. They're there 24 hours. So we have good backups in addition to the emergency physicians when we need it. In addition to that, we're one of the largest emergency departments in the state. Depending on how you calculate it, 1 to 3, depending on whether or not you include outside ERs and things like that. Yeah, we have an intensive care unit. Our mental health facility here is amazing, and occasionally students do need access to the mental health services we have here. We have in-house psychiatrists that staff North Hartford 24 hours, and especially the stress of being a new student, you can occasionally need access to those resources, and the reviews from those places are really excellent. I think everyone enjoys the interactions they have with that. And again, the student deans are there with them before they go and explains what's happening every step of the way, and all that type of thing. We have a world-class cancer center. We have subspecialties, including electrophysiology. We have a ton of electrophysiologists, wide range of diagnostic abilities. Any labs that surrounding facilities need, they send it to regional to get ran and done the results, because we do all the more specialized testing. Robotic surgery, I know urology, Dr. Tom, and those guys do some unbelievable robotic surgery. So does OBGYNs, actually using it a lot now. Other things that are probably important for you guys to know, we love seeing the kids. The kids are always great. So they should never hesitate to come to the emergency department. If you're scared and it's after hours, just send them over to us. We're happy to see them. The doctor's always happy to talk to the patients. It's not a burden. So don't feel uncomfortable asking your son or daughter to talk to the doctor. The easiest way is usually just that text or ask them if they have their phone. And we have chargers, so they should have their phone there that's charged. That's the easiest way. You can always call the hospital directly and ask to talk to the doctor. One thing you need to understand, I can only say there are rules in regards to HIPAA. If you ask, what did my son's blood alcohol level or what was her drug test show, I can only tell you if your son or daughter tells me I can. And I ask before I ever get on the phone, what can I share and not share with the parent? And most of the time, the kids are pretty fine with me saying whatever. Remarkably, I'm fine that you can tell them the truth about everything. I'm always impressed when that's the case. But that is sometimes a point of contention is what can I say and not say. So just so you're aware of the restrictions there. But like I said, don't hesitate to call. I try to reach out and talk to the parents on every patient, and then we talk to the dean, and then afterwards we refer to the student health center, and they follow them up pretty promptly thereafter. Other services offered, we top tier center as far as I know, heart failure and COPD were very high performing. We've been focusing strong on those areas. Sepsis is what we're focusing on now, and we've really made some great strides over the last 6 months on our sepsis care, and we're hoping to get some high performing results on that as well. And then most recently, we've opened up a safe center here in partnership with the University of Alabama, the district attorney in the state. This is a very specific sexual assault facility that provides care to anyone that may have been involved in any type of sexual assault, suspected or otherwise, whether they're a student or anybody in the surrounding community. And this has been an excellent resource. It's staffed by nurses that are specially trained for this type of encounter, and they respond to this 24 hours. So most of the time what you'll see is the patient will come to the emergency department, they'll get a medical evaluation by the emergency physician, and then the sexual assault examiner will come and we'll talk with the patient and take over from there. And if you guys have any questions, don't hesitate to call or reach out. We're always available and we love to interact with you. So we appreciate you trusting us with your kids, and we work to do the best we can. So thank you all very much.
So as you can tell from both Dr. Lovely and Margaret talking with you today, we hope that you can see the great partnership that we have with DCH Regional Medical Center, as they are just across the street here from the Student Health Center and Pharmacy. If your student does need anything, they're located very close to campus. If it is that emergency, we do recommend that they go straight to the emergency department. While we do have very, very generous hours here at the Student Health Center and Pharmacy, if it is after those regular business hours and your student needs to be seen immediately, definitely recommend encouraging them to go over to DCH Regional Medical Center and be seen so that they can get that care that they need. And we will talk next week a little bit more with our Office of Student Care and Wellbeing to talk about those resources that the on-call deans are able to offer for your student. But we want to make sure that they are provided not only the medical care that they need, but the emotional support as well, so that they can make it through whatever is going on with them. And we just want to say thank you so much to the Student Health Center and Pharmacy, as well as DCH Regional Medical Center, for all of their resources that are provided to students. And we hope this makes you feel a little bit better, especially as we are kind of hitting the height of flu season. We'll give a shameless plugs for all of our flu shots taking place around campus. So we encourage you to tell your student to go ahead and get their flu shot on their way to and from class. They can get that for free from some of our Capstone College of Nursing students. So we would love for them to get that free flu shot. They can walk straight into the Student Health Center and Pharmacy and get that flu shot right away. So we want to protect them as much as we can and keep that flu off of our campus. But if you do have any questions directly for Student Health Center and Pharmacy or DCH Regional Medical Center, definitely reach out to them. We hope that this has been an informative presentation for you. We hope you learned a lot about our great partnership, and we look forward to seeing you back next week. And as always, roll Tide.